I'm Rich Grossberg. I'm the medical director here at the main campus at the Hattie Larlham Center. I've been here since 1999 and lead our nurse practitioner, respiratory therapist, and our wonderful nurses here at the center. The medical team consists of myself as a pediatrician and also a nurse practitioner that I work with who's here full time. We also have respiratory therapy 24/7 in the building, nursing 24/7 in the building, and then of course our direct care staff, which do an amazing job providing the in and out daily needs of all the patients. Yeah, so we have 126 beds here with about 3 beds for respite where kids who have similar disabilities who live at home come here part-time. But the children who live here all are medically complex, and now when I first got here in 1999, we had about 12 kids with tracheostomies, but now we have 12 kids who actually require ventilators in order to breathe and live, in addition to having another dozen or so kids with tracheostomies. So the kids are quite complex. They all have a brain injury. Most of the time that happens somewhere during pregnancy or delivery, and as a result they have motor impairments, so they can't move like you or I, they can't speak very often like you or I can, but they have a whole host of medical problems, from seizures to recurrent pneumonia to feeding difficulties, which means they have to rely on a tube in order to be fed, to constipation and bowel issues, and a whole host of orthopedic issues like spasticity, scoliosis, and hip issues.
Every year we do a comprehensive eval with the individuals, so they'll get a PT, OT, speech therapy, and massotherapy evaluation, and then it's determined at that point what their level of acuity is going to be. We work a lot with feeding with the individuals. We determine what texture of food that the individuals are able to safely eat. Residents here have extra tone and they have difficulty relaxing their muscles, and so they get in the pool, and with that extra heat that helps to relax them, and then they receive their physical therapy, occupational therapy, massage therapy in the pool itself. We're just striving to make sure that they're happy, comfortable, and able to achieve their highest goal.
The kids need monitoring equipment, so very often when they're ill we need equipment to suction, to provide oxygen and measure how they're oxygenating. In addition to that, they have gastrostomy tubes and trach tubes that have to be provided for them. But their beds are pretty critical. As you can imagine, the kids here, they can't move on their own, and they have to be repositioned by our staff in order to avoid pressure sores. So the beds we have are sort of in between a home bed and a hospital bed. They can move up and down, and the bed can go up and down just like you would see in a hospital. This positioning is important. A lot of our kids have reflux. They can't move their gastric stuff along normally, so if they're not kept in an upright position, they can have emesis, which can cause pneumonia.
Respiratory illness is one of the #1 dangers to the residents that live at Hattie Larlham. On a daily basis here on the Woods, every resident receives some sort of respiratory therapy. On the Meadows, over half of them on a daily basis receive some sort of respiratory therapy, and then they're sporadic on the other units.
What impresses me more than anything would be the love and devotion of our staff. The kids come here, they are taken from out of their homes and their families can visit, but in some cases there aren't family. And what we see here at the direct care staff level is they become sort of pseudo-parents to these kids. They hold them, they comfort them, they clean them, they support them, they bathe them, they help them achieve. It's really quite an amazing thing to see. So I think from my perspective, while I'm always awed by what we do here medically and the expertise that we bring to the table, I would say it's the love and kindness that I see from staff at all levels that makes us such a unique place.